What's up, nurses? Welcome back to the podcast. Today I had an interview with a nursing student. As many of you know, yes, I graduated from nursing school, but it was a really long time ago. That was back when most exams were not on the computer. Most were on a Scantron. Do you know what a Scantron is? I don't know. Maybe not everybody knows what a Scantron is. Fair enough. But the only exams that were on the computer were my ATI exams, and my NCLEX was definitely on the computer, but everything else was like pen and paper, or I guess pencil and paper. Back in the day, we still had physical textbooks that you had to carry to all your classes, and nursing school's changed quite a bit since 14, 15 years ago. So it was great talking to Padraic. He is a BSN student in Kentucky, and he shares with us things like what nursing school is like now in terms of technology, expectations, what clinicals is like. He also is someone who is working as a nurse extern and worked as a nursing assistant and then transitioned into the extern role. So I thought that was really great insight from him about that kind of a role during nursing school, which I'm such an advocate for. So here we talk to someone who's in the thick of it. So his perspective is very helpful, and I think it's encouraging, and I hope that you guys enjoy the episode. Let's get into it. You are, let me make sure I understand, BSN student.
Yes.
How far into the program?
I'm in my third semester.
Okay, great. Because you had said that earlier, but I was like, wait, that was a while ago. So
you're
third semester. Is it an accelerated program or straight up BSN?
It's straight up BSN.
That's what I did too. And then you're working in a medical ICU as a technician.
Yes, I'm actually a nurse extern now. So it's a little bit different.
Okay, please explain that.
Yeah.
What is the difference between you being a critical care technician and a nurse extern?
So technician is just your typical CNA.
Mm-hmm.
So the hospital I was at, that was a technician, they were just starting to start with phlebotomy training and 12-lead EKG training. But besides that, it's just your typical CNA type role. Helping a lot more with turns, stuff like that, and kind of blood sugars, stuff like that. Changing with it was ICU, so obviously the nurses have a little, like 1 to 3 patients, so they're not going to be. You're going to be helping them a lot more. But with this nurse extern, I'm able to do any of the skills that I've been checked off of in school. So I've gotten to start IVs. I've gotten to hang meds. The hospital I'm at, they mix a lot of their own drips. So I've mixed my own pressors, antibiotics, stuff like that. So I've done a lot, which is nice.
And you're getting paid for it, right?
Yeah. So
now, did your pay rate change when you moved to extern?
So it's a small hospital, so I actually took a pay cut going into internship. But obviously it just depends on like the hospital you're at. But it was more for the experience than for one.
I would have easily done that. I mean, yeah, like that sucks to make less money, but to get those reps in during school, that was amazing. Now, do you hope to work on that unit like when you're done?
So it's a small rural hospital where I'm working right now. It was just kind of like what was available in my area at the time. I'm hoping to go to a larger hospital once I graduate. There's a level 1 trauma center kind of close to where I'm at right now in Lexington, which I'm hoping to kind of get into, just kind of see a little bit more. And they have a lot more specialty ICUs that I'm hoping to explore.
Yeah, that's kind of the thing I think some people when they get into nursing school don't realize is like, if you want to do that stuff, wonderful. But if you do live in a rural area, like your options are like, okay, you can do community access or community and critical access, but if you want to work in like a ICU with like ECMO, you might have to you will have to be in a bigger area.
Yeah. And I definitely didn't know that like at all, because I'm from a suburban area growing up. And like kind of working in that area, it's kind of, a little bit mixed. It's not like huge hospitals, like teaching hospitals, but they're kind of a good size, which going into a rural hospital, it kind of, you take for granted what you have.
I
Like,
went I went to nursing school in rural Iowa.
oh wow.
And I was about 45 minutes away from the University of Iowa, which has a massive nursing program,
Uh-huh.
massive medical center, and like research facility. It's very top notch, but I'm like an hour away from that. So
Uh-huh.
I'm in like 10 bed ER with like a med surge unit with maybe 15. Like
Yeah.
their ICU would be like
Uh-huh.
a step down at the most at a larger hospital.
Yeah.
It's like, man, like for anything, they're getting shipped out.
Yeah. That's kind of how it is where I'm at right now.
Yeah. Yeah. But it's still incredible experience to have,
Yeah. Heck yeah.
especially third semester. Here you go. You're
Uh-huh.
like mixing pressers and stuff. That's
Yeah.
amazing.
Yeah. And like like I said, I got checked off on my skills kind of, let's see, like I think the beginning of the second semester.
Hmm.
And you don't really get that much experience in clinicals doing all those skills because it's very limited.
Hmm.
So having like kind of where you're able to kind of do repetitive skills on actual patients that aren't mannequins,
Hmm.
they're a lot different. It's kind of nice to be able to, hone up on those skills in real life practice versus what you're taught in textbook, what you're taught in class, because it doesn't always correlate.
Oh yeah. And then I don't know. I don't know if you had this assumption, but I did, where it's like, oh, I learn a skill, I show that I can do it. But being able to do that in the classroom or even with your professor next to you or your
Yeah.
clinical instructor next to you,
Uh-huh.
you really need those reps. Like
Yeah,
over and
absolutely.
over and over again so that you can do it without really thinking about it. And I was just like surprised, I guess, at how like,
Yeah.
oh man, I really do have to do this over and over again to actually be
Yeah.
comfortable with it. I thought I'm fine, but I'm definitely
Yeah.
not.
Which I mean, like it's definitely something you gotta be able to do. But like going in like as a new grad, I can't imagine like not having that practice. And you're not on your own, but you're kind of expected to be able to know how to do all these skills, right? You have the license. So kind of with that, like just being able to, practice it is really nice.
Oh yeah, and then a lot of preceptors are great, but sometimes you have someone who's not so great,
Yeah.
and you don't have as much like experience to draw on. So I'm
Yeah.
such a big proponent of becoming a nursing assistant if you can in nursing
Yeah.
school in any capacity. Just like even
Yeah.
the getting reps with talking to people when they're hospitalized.
Absolutely.
It's so awkward. Like
It is.
I don't know. I just and also like when we're in an increasingly online world,
Uh-huh.
having like those intimate conversations where people are having the
Exactly.
worst time in their
Yeah.
life. And years ago, that was also, I feel like I'm a bit of a people person, but that was weird for me to like be in the room with people going through a really hard time. And they're like looking to me for my perspective.
Yeah.
That was quite a jolt. So to get those
Yeah.
reps in like physically being in a clinical
Absolutely.
environment is, I think, well worth even like a low pay situation and
Yeah.
also the networking that's there too. I'm sure you're
Oh
going to
yeah.
have all these references for wherever you end up going
Yeah.
from all that time that you've had there.
Yeah. It's definitely a blessing.
Now, here's my tip. If you have a physician or two that you work with, ask them
Yeah.
for a reference.
Oh, I didn't even think about that.
I was in that rural hospital in an
Yeah.
ER, and you would always have, it's a smaller area, so you
Yeah.
have the same physicians all the
Uh-huh.
time. And I was like, you know what? I'm going to ask them. Like, what are they going to do? Say no?
Yeah.
Okay,
Yeah.
I'm literally never going to see them again in my entire life. And so I
Yeah.
asked them, and they were elated to do a reference for me. So I
Yeah.
got like 3 physicians to write
Wow.
a reference for me for my new grad job.
Wow. That's amazing.
So if you're already working there and you're
Yeah.
building rapport, my big recommendation.
Yeah. That's good to know. Thank you.
So, what has it been like working with nurses at clinical? Like, I think that's something that is weird for like
Yeah.
students to think about. Like, what is it like? Am I being somebody's shadow? How how has your experience, not at work, but in your actual
Yeah.
clinical with your clinical group been like?
Yeah. So the way our program works is we have our main hospital that's kind of, our university hospital. But then because our class is so big,
Mhm.
they kind of reached out to the local hospitals kind of around us. And we do some of our clinicals there, just depending on placement and numbers and stuff like that. So I've worked at kind of private hospital, but I also have had clinicals in the teaching hospital. And I will say there's a difference kind of, in the teaching style, and kind of what you can do and what the nurses are eager to show you and stuff like that. I will say like teaching hospital tends to be a little bit more of people wanting to teach you because that's, they're used to it all the time.
Okay.
It was definitely interesting talking to residents because I usually never talk to residents. Usually I was like, what is this? Who are you?
Man, my first job, like I did nursing school and didn't have much teaching hospital experience, but then when you see like how that functions and their residents who are just out of med school, they're just as much deer in the headlights as you are, but they're having a different focus and like understanding how the doctor hierarchy works.
Yeah, absolutely.
And at a teaching hospital, you have a flock of residents going from room to room and checking out your patient. Who do I talk to? Like,
exactly.
And they're still learning so much too, that it was a very interesting dynamic.
Yeah, I felt like they were a lot more approachable though. Maybe I was just kind of the people that I was interacting with, but they're willing to teach and they're willing, they don't see you as just like a nursing student, right? They're like, hey, jump in here. We're doing rounds. Like, what do you want to know? Like, what do you have to bring to the table? This interdisciplinary kind of rounding. It's like,
yeah, I feel like they're definitely more welcoming than like, not saying all older physicians are like this, but like they're very doing their thing. They're in their process and what you're going to find at the private hospital. But then when you have, they have a chief resident and then they have their attending and everything. And they're definitely more in a teaching mode and like learning and those attendants are much more, or attendings are much more like clued into the teaching aspect of it, where you have people who are just, I'm here for my job, I'm not teaching anybody. Like being the nursing student and experiencing those two things is quite different.
I mean, I definitely say like fundamentals, you're kind of more of the shadow. You're kind of just following them around because at least the way ours was set up was the only thing that we could really do was our assessments. So to me, I felt like I'm going in this patient's room, not providing any patient care. Like they're miserable. I don't want to, interrupt them and be like, hey, can I do an assessment on you? But honestly, that practice was key. I mean, your physical assessment skills are like, you got to be on it to notice any changes in your patient status. But like as the program progressed, like I just finished my PEDS clinical, and that was you kind of on your own. Like your instructor's there to pass meds with you, but you're in the room kind of by yourself, just doing your own thing, doing your assessments, talking to the patients, talking to the patient's family, and then your nursing instructor is just kind of helping you do the skills, and then just kind of correlating with the actual primary nurse of your findings or kind of questions that they might have.
It's nice to have that autonomy, you know, like without I remember going from feeling like the shadow to actually being able to do things, which felt really good because you feel like such a burden. I don't know when you're when you have to shadow. Now, when you were like starting nursing school and you were thinking about what your clinicals were going to be like, what has been like surprising? Like, was there anything you're like, I think it's going to be like this, and then it wasn't like that, or something was better or worse than you thought it would be?
Yeah, I mean, I think it helped I think I was a tech right before I started like the actual program. So the way your University of Kentucky works is you do a year of your prereqs, and you're considered pre-nursing, and then you apply, like I think in the March of that spring semester, and then you start in either the fall or the spring semester the next year. So your sophomore year, if you follow that. So I started in the fall. So that summer I was working as a tech. So I kind of, it wasn't really a teaching hospital, so I didn't really see that many students, to be able to be like, oh, I know what they do. But just being a tech really like, I mean, that's basically what you're doing as a nursing student, plus a little bit more, obviously. But like, so I kind of had that kind of, jump to the start, I guess, with that, and kind of seeing that. But anything that stuck out to me, gosh. Um, it's a hard question. I don't know if I like. I feel like I just, you're just in the zone, like you're just grinding
Yeah.
through it, taking it one class at a time.
Yeah. Yeah. I think it can be like, I don't know, when I was anticipating it, I
Uh-huh.
had no hospital experience
Okay.
first. So my first clinical was really nerve-wracking.
Uh-huh.
And since I have highly recommended to so many people to do the CNA thing or any
Yeah.
hospital, even simply volunteering in a hospital, just so
Yeah.
you can like bring the anxiety from like a 10 like down to like
Yeah.
a 4, maybe like something that's more manageable because you're not in that
Uh-huh.
environment yet. And it is intimidating and fast paced, even at a rural hospital.
Yeah.
There's a lot of things to get done quickly, and everybody expects anyone who has scrubs on to know what they're doing.
Exactly.
And it's like, please don't ask me any questions.
Yeah.
So here's a question for you. I went to nursing school many years ago. I started in 2007 and I graduated in 2010. And back then we were still doing tests on paper and on Scantrons. We didn't have any online textbooks. We had no online discussion boards. It was like they had just started doing online courses.
Yeah.
So what I think experienced, especially ones that are even more experienced than I am, would appreciate is I'm just curious how your program is structured tech-wise. Like,
Yeah.
how are you doing tests? Do you use ATI like we used to use
Yeah.
back in the day? Like how are you like working through that program?
Yeah. So all of our exams are online, through, I guess the university bought like a
Okay.
software or whatever. So it's just kind of, through that software.
Do you find
Um,
out immediately what you got?
yeah. So it'll give us our percentage right after we take it, and it'll give us like, we can review the questions that we miss, and
Oh,
then
that's
sometimes,
really
yeah,
nice.
and sometimes the teachers will put in like the rationale with
Okay.
it as well to kind of go back and review it. And then obviously like that's like kind of the raw score. And then if there's questions that like everyone did horrible on, the professor might, drop that question. Or if
Okay.
there's like an error or something like that, or just give points back is kind of what we see in Canvas is what we use. So we'll still input that grade into Canvas. But yeah, that's how we take our exams. Our textbooks are online, but to be honest, most of my professors just teach from the PowerPoints. They draw from the textbooks, but I don't think I've actually read like the textbooks for any of my
Do you
classes.
have to get them?
It's kind of just built into our course fees, so it's
Okay.
all online. And then some like they'll have assignments. It's Elsevier is
Hmm.
what we use. So they have like our assignments that built into it, and you have access to the textbook. But a lot of the times it's just you read the PowerPoints and then you can just answer the questions. So that has been nice, not having to scan through chapters of textbooks.
Do you guys use AI? Like, are you seeing AI, you even in ways like maybe I'm not supposed to use AI, but
Yeah,
like how is AI impacting nursing school?
yeah. I mean, to be honest, I've used it for and it's not like using it to cheat, but you know, just I mean, it'll give you like care plan for a patient with COPD.
Hmm.
It'll give you all this stuff, and it's like as a nursing student, you're like, wow, like we've talked about that, and then you can go in and do your own stuff on it. But it's been helpful with that. I've had it made like study guides for me, so I'm like, here's the PowerPoint, like come up with a study guide or
Hmm.
come up with questions. And it'll put in questions, and it's like, whoa,
You
pretty
know,
nice.
or if there's like a concept like Krebs cycle or something
Yeah,
that's very difficult to like really grasp from like a explanation. Because what I've done, I have children and they ask
and
me a question that I don't actually know how to explain. I'll ask ChatGPT and be like,
yeah,
explain this like I'm 5.
exactly. I've done that before.
I could imagine I would have done that had AI been around back then and been like,
Yeah,
okay, explain this to me like I'm 5. And then you can ask it questions. Now, granted,
ex-
not everything's going to be right and perfect, but man, that
yeah,
will
no,
help like get you asking the right questions.
exactly.
Have your
Definitely.
professors had to do anything to like, I don't know if you have to do ever any essay things where they're like, I can tell this is AI. You know
Yeah.
what I mean? Have you had any of that kind of stuff?
So when we submit like any of our papers, it has a software called Turn It In, which will
Oh,
check
yes.
plagiarism, and it also checks, I think, for AI. Um, and it'll give us like a score or whatever. And then I never had any issues. Um, and then of course in all of our syllabus, it's the copy and paste it, like do not use AI, blah blah blah. And so that's how I guess they deterred from it. But
Yeah. Wow. What an interesting thing. Like, I would have
yeah,
never anticipated that coming
yeah,
up.
literally.
But,
Yeah,
like, while, yes, sitting here and trying to think of like all the care plan things, as a new nurse, like the way that you can do that, like, say a patient
yeah,
has X and here's the care plan things, you draw on your experience and the education you're getting. So
yeah,
to like, I always felt like that was a very hard thing for me to do, was like, all right, the patient's here with this. What are all their interventions? And it's like, it's
exactly.
actually really hard for me to come up with that because I have no context for this.
Mhm.
So it's like, hey, I can probably help you fill in some of that context. Like, oh,
Yeah,
wait, that does actually make sense that, ineffective airway clearance for my pneumonia patient. That actually does
exactly.
make sense. But I'm like so deep in the weeds of I don't know what matters to
Yeah,
be able to pull
exactly.
that out.
Yeah, and it's like you're going through all the stuff you learned in nursing school, and you're like trying to figure out like what did it say on that one slide or that PowerPoint, and there, it takes 30 minutes to go back and try to find that, right?
Right.
Versus this AI, they pull from so many sources,
Okay.
so that's
And
good.
I always feel like nursing school is a little backwards. It's almost like you should have like 2 years of constant experience where you're with people who are like kind of telling you about some patho and
Yeah,
stuff, and they're with you and you're not alone. And then as you're in the classroom, that they're really solidifying some of that stuff so you can think, oh, wait, I did see a pneumonia patient and they had X, Y, and Z, and that's the
mhm.
antibiotics. Like, I don't know. It's just so hard to make things like nursing theory and even some of the fundamentals make sense when you've not
Yeah,
really had any hospital experience.
yeah, yeah. I agree.
Here's a question for you. If you could go back to high school, you graduating from high school and like, okay, I know what I'm going to do. Maybe you didn't at that point, but what advice would you give that version of yourself now
Yeah.
knowing what you do this long into nursing school?
Uh-huh. So I took a bunch of AP classes, so I have advanced placement, whatever it is.
Hmm.
Um, a lot of them you have to have a certain score to pass, to get the credit for college, which I didn't get that. And hindsight, if I knew I wanted to go to nursing school, I probably would do one of the community colleges programs to where you get your CNA license with it, and then you
Wow.
also get some of your, I don't know what, I think you get like your anatomy done,
Hmm.
and you can get kind of some more of your gen eds done. So you have a start to the program already in high school, which is super nice.
That is amazing. Like to graduate with that kind of stuff would
Yeah,
be insane.
yeah. I mean, because we didn't have to. It wasn't required to get our. We had to get our CNA. We had to do the course. We didn't have to get our license, but we had to have the course done to
Okay.
start the nursing program.
Okay.
So, and you had to pay for that on your own. So it was like, I mean, that's a big chunk of money. So if you get that in high school and you can start working that summer, and especially that would look so good on, I think, on your nursing application for nursing school.
Yes. I mean, yeah, like not only do they have experience, but they're on top of things. Like they want to.
Yeah,
Now, to be fair, to have that kind of insight as a high schooler would be, I really know I want to do nursing. You know what I
exactly.
mean?
Yeah,
Yeah. Yeah.
yeah,
Which
it's
would be
definitely,
hard.
yeah. I mean, I knew I wanted to do healthcare, but I mean, at that stage, you're like, oh, like there's so many different ways to go. Like, how do I know which one's for me?
Oh yeah, and then you're just consumed in high school too, because you got, that's just like a lot going on. So to like order those steps perfectly is pretty hard.
Yeah, which I
Would
mean, I will say like high school's a time for you to be a kid still.
Yeah.
Like you have so much time to be an adult later in life. Like, yeah, it's nice not to have to take so many classes, but I couldn't imagine like graduating in 2 years right out of high school and being a nurse.
Oh yeah.
'Cause-
Yeah. I mean, you
well,
can do that, but it is like you have to really know, and you have to go to an ADN program, and
yeah,
then you look like a 20-year-old because you are a 20-year
exactly.
old.
You are like 20, you can't even drink yet, but
I
you're
know.
you're able to give
Dilaudid. IV
context for,
push.
yeah,
Yeah, I remember working with, but to be fair, like if I had my like stuff together and knew I
Yeah,
wanted to do nursing, I would have done ADN out of high school,
yeah,
and I would have worked right away, and then whatever hospital I went to, I would make sure I have some tuition reimbursement and get an
yeah,
RN to BSN bridge. And
yeah,
then you have school is like a fraction of the cost, and
uh-huh,
you're already working
yeah,
too. Like I remember graduating and then talking to people, about their student loan debt and stuff.
yeah.
And there were people who went to like these highly expensive
Oh,
private
shit.
schools
Man, yeah,
whose like loan payment was like $1,400
yeah, that's insane.
10 years ago.
Yeah. Oh my goodness.
And you passed the same test.
Exactly. You have the same scope of practice.
And I don't know if you've ever had, well, you might because you're in school. Since graduating, I've never had a patient ever ask me where I went to nursing school.
Yeah, no.
Not one.
Yeah. I mean, in school when you're a student, I think they ask kind of like, oh,
Oh, where you go to school? Oh, that's pretty
yeah.
cool. Yeah. But like when you
It's
got
not
that
like, are you getting
RN,
your
like,
BSN or ADN? They're like, you're a nurse. Okay, cool.
right. That's what they care about.
Yeah.
Now, would you tell graduating PJ anything else?
I don't know. Just enjoy it.
Yeah.
I mean, soak in as much experience as you can. Explore different hospitals, see what's out there. Your hospital that you were born at and you were, volunteered at might not be where you want to be when you graduate. So just kind of, see what else is out there. Because it's so different. Each hospital is different.
That was kind of a misconception I had was that healthcare is just uniform
Yeah.
and nursing school to a degree is quite uniformed. But then when you go from one hospital to another, you realize how different
Yeah.
people do things and how different policies are. And
Mhm.
even just talking with people like, oh, we do this at our hospital. Oh, we do this at our hospital. And
Yeah.
culture can be so different. Like I went from one hospital that I thought was the best thing in the world
Yeah.
and I loved it. And then I go to another one and it had things that were great, but it also had things that it was not doing anywhere like this other hospital was. But then this
Exactly.
hospital had things that were not so great. So
Yeah.
it was just like, oh, wait, there are big differences that can actually
Yeah.
be different from me as the end user bedside nurse. This isn't
Uh-huh.
like the way nursing is done everywhere, which is what I thought at those first few years.
But it just makes you, I think, adaptable. Like,
Yeah.
I mean, now we have a saline shortage of IV fluids. And it's like, how do you adapt to that? And it's like, well, if you're a smaller hospital, it might be that you don't have it all the time, or you have to use something different. So, just being able to have that knowledge, I think, can lessen kind of the shock factor. I think.
Yeah, and
Which,
that adaptability is so important because when you have so many tasks that you have to master,
uh
you can get very locked into them and become inflexible almost of
yeah,
like, oh, wait, well, I have learned to do it this way. There actually are different ways to do it. And there might be some superior ways to do it, but you've been doing it for
yeah,
this way for 5 years. That doesn't necessarily make it superior. So it is a little bit of a shock to see how different things can be done. And it can be a little unsettling. Like, wait, I thought we all did the same thing. And I
yeah,
was just learning what the same thing was. Now I'm
uh
like, I'm actually just learning a framework.
yeah. Which that's hard, especially for like nursing students, because it's like we want the absolute answer. Like we want to know exactly what we need to do, and you know, not all the time you're gonna have clear cut. This is what you're doing. You kind of have to have that build on that critical thinking skills.
Yeah.
And
It's like you expect to learn, okay, every patient with X gets
yeah,
this. And it's like, well,
uh-huh,
yeah, but that patient could have Y and Z and
uh-huh,
A and B. And that makes the treating of X completely different. And it's like, wait a minute.
exactly.
No, 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 no. I can't handle the nuance.
Yeah,
Give me the black and white,
uh-huh,
which is actually, to be fair, a very normal part of development.
yeah.
But it does get overwhelming once you get out there and you really realize the depth of the nuance. It
Is it?
can be a bit overwhelming, but it is a very important part of like growth and development, and that translates to any other field. When you're in the learning mode, you're going to have the black and white, and you have to understand that first before you dip into the gray.
Absolutely.
Yeah. Here, okay. Let me think. I have another question for you. So, nursing school obviously is super difficult.
Yeah.
Actually, I was just on TikTok, and like, there's 20 TikToks of like there's like, I don't know what sound it is that's trending, but it's like how so difficult nursing school is. If you could have like a magic wand and like wave this magic wand and have exactly what you need to make nursing school easier, but it wasn't excluding tell me all the right answers. What do you think? What would that be? Like, what would make your life so much easier?
I'd be coffee, but that's not actually.
We have a shortage, PJ.
Right. Yeah, we can't. We gotta ration it out.
Gotta ration it.
But no, I don't know. To be honest, I don't think nursing school is that hard, and it's not like I'm the brightest, smartest student out there. But I think just kind of, I don't know. I don't get wrapped into all the different stresses of what everyone's talking about. Oh my gosh, this exam, this, that. Can you believe we're having to do this? Like, just kind of taking day by day, exam by exam, class by class, going with kind of, okay, it's not like I'm locked in my room all night studying. It's taking those, doing that small little increments of studying so that way you can enjoy going out with your friends or doing stuff like that.
So do you attribute like that to like good organization or good time management, essentially?
Yeah, I think that's a good way to put the nail on the head with kind of what you're talking about. Yeah, absolutely.
Yeah, because like if you're not, I guess when I was in school, my mentality was like, okay, let me get all my deadlines written down and let me figure out like a rough time management plan.
Yeah.
So that the night before papers due, I'm not losing my mind trying to write a 10-page research paper.
Exactly.
And a thesis that doesn't make any sense. But yeah, I do find that like if you're not proactive and your time management, like it does make the overwhelm much more exhausting.
Yeah. And I would say like I enjoy what I'm learning. Like I love nursing. And so I think if you enjoy what you're doing, it comes a lot easier. It's less of a task or chore and more of a, this is interesting. I want to know I want to know so much more about this. But to answer your question, like a magic wand, gosh, sorry, I'm not like really answering your question.
That's okay. I'm just curious. It's like, of course, some people probably would say AI, and now it's around.
Yeah. Yeah, I mean, I don't know. AI kind of scares me in the long run.
Oh, yeah. Well, yeah, especially in healthcare. There probably will be ways that it will be used in very helpful ways. But I'm scared we'll probably use it to decrease physical labor. In individuals with, there will be errors and things that it's like, well, the computer's not going to know that that's an error. And
yeah. Or have compassion.
Or a pulse.
Or pulse.
But what I think your mentality of having good time management in nursing school will translate so well to being a bedside nurse, because that is absolutely one of the top things that new nurses struggle with is time management. And like holistically stepping back mentally and like, okay, wait, I have 12 hours of tasks to get done. How can I like strategically attack this? Because a lot of, I think human natural behavior is to just whatever the next thing in front of me needs to be done.
Yeah.
As opposed to, and I think it can be in nursing school, like mentality. What's the next test? What's the next this? Not, okay, I have something in 2 weeks that I need to do a little bit of.
Exactly.
And that's when you can get so overwhelmed, because then all of a sudden certain things merge and 3 people need something at once, or 3 classes have something due at once.
Exactly. Like one small nuance will throw your whole entire system off. Yeah. You gotta be able to adapt.
Yeah, man. It's It's definitely something for people who are proactive
Yeah.
that really thrive in it, and then they can focus on optimizing rather than surviving, I guess.
Yeah.
Which is cool to hear that you're probably in an optimize, not survive situation. So, what has been more challenging for you though, like the classroom or the clinical?
Um, Definitely the classroom. I'm
Okay.
definitely a lot more of a practical guy. Like the the skills weren't an issue at all. Like kind of, more muscle stuff, hands on. I mean, patho kicked my butt, I will say. That's just,
Yeah.
I mean, it's just understanding the little nuances of whatever it is. It's just, that's where I struggle understanding that. But yeah, clinicals have been fine. And I think that attributes to working in a hospital.
I was gonna say if you didn't have that experience working in the hospital, even just for a summer, like do you think that significantly impacted your ability to thrive in clinical? Or if you came in cold, how do you think you'd do?
Yeah, I mean, I don't think it's end all be all, but I definitely think it's a huge help. I mean, I've talked to so many people that have worked in hospitals and people that have not worked in hospitals before starting nursing school or in nursing school. And we all kind of come up to this like same consensus, like that it's just, it helps you. It's not going to teach you how to be a nurse, but it will allow you to kind of understand how the nursing process works, how a hospital works, what all these sounds are. Um, okay, I've seen a patient that is, oh gosh, like on a non-rebreather. So I know what that is. I know what that does from just talking to the nurses about it,
Mhm.
which helps going into clinicals. Because one, you're able to talk to patients, you're able to go into that patient's room, which is, I mean, that was the biggest nerve-wracking thing I've ever done. Like starting
Walking in
out,
the room.
yeah, just knocking. Hi, like hello. You like feel so like I don't know, like small,
Hi,
like a little mouse.
Mousy. Can I please come in here, please?
Yeah,
I'm so sorry. I have to do this.
yeah, exactly. And you have that confidence, and I think I think nurses can tell the students that are kind of more confident in their skills and
Mhm.
what they're able to do.
And they don't even have to be amazing at the skills.
Oh,
They just have to kind of have the balls to be like, all right, let me try this. Okay, I've not
uh-huh.
seen this before. You know what I mean? Like, or tell me more about this. So, yeah, I don't know.
Yeah,
I have seen people who are not great skills wise necessarily yet,
yeah,
but they just feel comfortable like talking and then also feel comfortable speaking to what they do know and
exactly.
open with, you know what? I'm actually not sure. I've never done that before.
Uh-huh.
I've seen people improvise and fake it, and it makes them like look much, much more incompetent than if they
Yeah,
had just said, I've never done that before. Oh,
which
well, what is
yeah,
that?
which
Like,
can get
there's so many
dangerous.
things to learn.
Yeah, like that can get dangerous as like a new grad is like admitting that or trying to think that you know everything,
Mhm.
which I don't know. I don't feel like you're ever gonna know everything, but that's why you have people there to ask questions.
Yeah, like even those experienced nurses, one of the big things is like they're not going to know everything, but boy, they know how to leverage those resources to figure out the
Exactly.
answer and kind
Yeah.
of like be confident enough in themselves to like save face to be able to like admit, yeah, I actually don't know that. Let's figure that out
Yeah.
together. Or I'll go find the answer and I'll be back.
Uh-huh.
I did an interview with a nurse practitioner who works in orthopedics with surgeons, and I
Okay.
asked her, I said, like, what is like the most cringeworthy thing that you see nurses do at the bedside? And
Yeah.
she worked at the bedside for years too, so I felt confident in asking her that question.
Yeah.
But she was like, when you ask someone a question or need them to do something and they don't know, but they improvise, and it's clear they don't
Yeah.
know what they're doing, but they're desperately trying to pretend like they do.
Uh-huh.
Because it's like nurses are people like they can pick up on that
Exactly.
kind of stuff. So if you're
Yeah.
like, sure, I know exactly what you mean when you say
Uh-huh.
strip the JP drain, like, yeah, I can do that. But they really don't know
Yeah.
what that means. Like,
Uh-huh.
please don't guess. Like, it's
Yeah.
okay for you to say, oh, I know I might need to know this, but forgive me,
Yeah.
I am new. What does this mean?
Uh-huh.
Yeah, I think so. That's such a big one. Well, do you have any parting advice for anybody in nursing school thinking about nursing or for experienced nurses dealing with nursing students?
Yeah. I would say for nursing students, have the confidence, you know, have, you know, like, yeah, you don't have to know everything, but, just being eager to learn and eager to, ask questions is key. Um, for experienced nurses, remember kind of that you were in the same boat at one point. We're still figuring it all out, but we want to jump in. We want to be hands on. Um, yeah, like obviously under the correct supervision and correct policies, but allow us to do those skills because one day we're going to be taking care of you, and
Yeah.
we want to be able to provide that care. So
Amen to that. Well, thank you for joining me. I so
no.
enjoyed chatting with an active current nursing student. I'm like thinking back, I don't know that I've had someone on the podcast before that was currently in nursing school. So I
Yeah,
really appreciate your time and your perspective.
yeah, thank you. I think it was interesting. I started listening to your podcast on my way to work because I was living in Lexington, and I was working an hour back home. So on my drive back, I would be listening. And then you did one I think on the Wake and Walking ICU.
Yes, with what Kaylee Dalton.
Yeah.
Dalton.
Yeah,
Yes.
Dalton. And I'm actually doing a research project on that because I found it so fascinating. Especially working in the ICU and seeing those nurses that are just so eager to like sedate their patients because they don't want to deal with it.
Boy,
So
I don't know if you can tell, but in that interview, I was like holding back tears.
I mean,
I can't tell you, like, I'm like, oh my gosh, I'm like rethinking everything. I'd never heard of a Wake and Walking ICU. And here she is, like, with all this information, and she is so passionate about it. And I don't know, that episode was like 2 or 3 years ago, and she's continuing to teach so much on it. And there's even more good research has come out about it.
I'm excited.
It is. But you know what? You're right. There are so many people who are very eager to sedate. And I shared about it on, I think it was Facebook and Instagram, and you would not believe the comments people had about that because of the thought of like that the deep sedation might not be the best thing.
Yeah.
And that the idea of getting up and walk, like it was just like, oh boy, that was a lot of comments to sift through. And even Kaylee hopped in on some of them because some people were super not cool. But it is interesting how a practice can be so deeply embedded. And it was so interesting her saying that, vents used to be really painful. And the vent technology advanced, but not our sedating practices, which it just makes sense. It makes sense that tech would evolve, but not the practice with it. It just, what human behavior, like, I don't know, it's just so interesting to me. But I hope in 10 years, her Awake and Walking thing is like standard practice. I really do.
Yeah, I'm hoping so too. That's why I'm curious to see like what the kind of what the standoff into why don't ICU nurses know about this, and if they do know about this, like as a nurse, why aren't we making those changes?
Yeah,
I'm curious to see what that barrier is. Anyways, I don't need more time.
I know. I bet a chunk of it, a large chunk of it is culture, right? Because if you're the only one on the unit getting your sedated patient up and the physicians aren't even up on that, it's like you have to have like charge nurses and informal leaders on the unit really like championing it. Which is because she'll go to like nursing units to help them implement the policy, which I bet is very interesting because ICU nurses, I mean, you work with them, can get a little particular, but it is typically from a place of advocacy and like, don't mess up my patient kind of thing.
Don't push my problems.
Don't you dare. So you can appreciate that, but then also like, hey, I'm not trying to like make your patient worse. I'm actually trying to help here.
Exactly.
Well, that's awesome to hear that you've been listening that long because that episode has been out for a little while.
I'm being a celebrity right now, so I'm ecstatic.
Well, thank you so much for your time.
Hey.
And I'm really excited for the rest of your career. You got to keep us updated. Like when
Yes,
you
I will
graduate,
definitely.
you gotta let me know when you pass that NCLEX
Oh,
and where you end up
I appreciate
working.
yeah, I appreciate it so much. Oh my God.
Well, guys, I hope you enjoyed the episode. Thank you so much to PJ for his time and sharing his experience. I hope that is helpful to those of you who are in nursing school or thinking about nursing school. And if you are a highly experienced nurse and just wanted to hear what the heck these kids are doing these days, I hope it was interesting to you. For those of you who are nursing students, we have a whole resource hub for you guys. It is freshRN.com/nursing-student. I will put a link to it in the description of this episode, but it's all of my content specifically for nursing students in one little spot. I have a few resources there. Like I have a ebook that I've written on the top mistakes nursing students make and how to avoid them. I also have a link to a great pre-nursing school or nursing school course from straight A nursing student and some other nursing school just prep options. So there you go. Resources for the nursing student to help you be successful. Sometimes the lectures and things going on in the classroom don't make a whole lot of sense, but the pace is so intense. You really need to make sure that you understand things before you progress to the next one. So a lot of people do use supplemental materials at home. So I'll put links to some of the ones that I really like that I have seen the back door, like looked under the hood and checked them out myself and really appreciate. They're all written by nurse educators themselves that own the companies. So they're not like this big corporation that is all a bunch of people who aren't nurses employing nurses. The ones that I really like are people who worked as nurses, and a lot of them are educators now. So I will share links to those in the description of this episode and as well as the nursing student page. As always, get on my email list, people. What are you doing? If you're not on my email list, what's going on? Come on. I send out lovely little emails every week about tips, tricks, and advice. So if you are a nursing student or considering nursing school, like these are just like things that I learned the hard way that you can be empowered to know and be miles ahead of where I was when I started. So thank you guys so much for your time and engagement. Likes, subscribes, shares of the episode with people you think would enjoy it is also really helpful. And just hope you have a wonderful day. Thanks, nurses. Stay fresh.